News today is that Christina Applegate's daughter was diagnosed with POTS. So for those that are not familiar with POTS, can you tell us exactly what it is and explain the diagnosis?
Yeah, sure. Thanks, Christina, for having me on. First of all, POTS is not a rare condition. It affects between 1 and 3 million Americans. It's mainly young women. Actually, 85% are young women of childbearing age. And it stands for postural tachycardia syndrome, meaning those patients have a reactive hypotension, meaning the blood pressure drops upon changing position, like from getting up from a chair or from the bed. Blood pressure drops, the heart rate shoots up, they become what we call tachycardic, and that then creates lack of oxygen in the brain, and as a result, people feel dizzy, lightheaded, they might even pass out, and affects basically every system in the body. And it's not life-threatening, which is a good thing, of course, but it's very annoying because those people can have those dizziness episodes 20, 30, 50 times a day and it's not going away. So it's most likely an autoimmune condition, a neurogenic dysfunction, meaning the nerves don't do what they're supposed to do by constricting the blood vessel when we change positions. It's an orthostatic dysregulation, how we call that. And there's treatment options, but first of all, it needs to be appropriately diagnosed in order not to miss other reasons for similar symptoms. And secondly, the treatment can be sometimes a little tricky and difficult, and oftentimes it's try and error.
Yeah. What are some of those treatment options, and why is it difficult to treat?
Well, because first of all, everybody reacts different. So the main issue is that there is an intravascular hypovolemia, meaning there's not enough fluid in the body. The vascular system lacks fluid. So hydration is the number one treatment. Hydration. And in some cases, it's not even enough to drink enough water. Water, by the way, it should not be pure water. It should be electrolyte containing waters. But I have several patients in my practice who require, on a weekly basis, 2-3 times intravenous infusions for several hours because they just can't keep up with drinking enough to keep the intravascular volume status high enough.
Do you find that usually people that are diagnosed with POTS are just extremely dehydrated and find it hard to keep their body hydrated?
Yeah, they don't appear on the first view dehydrated, meaning they are not dry. And they often tell me, well, I drink a gallon of water a day. And that might be true, but especially in young people, young women, that might not be enough. So hydration is a number one goal of treatment, basically. But there's other options, of course. Another thing is what we tell our patients always is, don't jump up quick. Because if you jump up, the blood vessels dilate, the blood sucks into the lower extremities. There's not enough blood going to the brain. You feel dizzy. So get up slowly, move your legs, move your feet, use what we call the muscle pumps first before you jump up. And I tell this the people in my practice all the time. And then I say, can you just go over here? And they jump up. And I say, didn't I just say don't jump up? So you have to remind them, don't jump up, go up slowly, use your muscle pumps in the legs first before you get up in order to avoid that drop into the lower extremities, which causes then again the dizziness and the lightheadedness and feeling extremely weak. But there's other therapeutic options, including certain medications which we use if needed.